Welcome to North of 60. I'm Heidi Schweighofer. Today we're going to talk about a subject that is very difficult for many of us over age 60 to talk about, and it's not what you're thinking. We're going to talk about hair loss and hair thinning in both men and women. My guest today is Dr. Angela Kyei. Dr. Kyei is a medical dermatologist at the Cleveland Clinic. In addition, she is an assistant clinical professor of medicine at the Cleveland Clinic School of Medicine. Her undergraduate degree was in Princeton. Her graduate degree was at Yale. Her medical degree was from Case Western University. So in addition to her Cleveland Clinic practice, she also has a private practice named Cosmopolitan Dermatology in Cleveland. And at the end of this show, we will give you contact information for both places so you can reach out to Dr. Kyei. I'm so glad you're here.
I'm glad to be here.
Nice long introduction
Yes.
for you, Dr. Kyei. Tell me, before we even begin, how did you decide to become a medical dermatologist and specialize in hair loss?
Well, I've always wanted to be a physician, a doctor. In my family, we don't have any physicians, and I grew up with my parents kind of, nudging me in that direction, and thankfully it was an excellent fit. When I was in medical school, we didn't get that much exposure to dermatology, but I had one rotation, and I loved it. It had just happened to be at the Cleveland Clinic, and I fell in love, and that was it. That's when I made up my mind.
How neat.
Yeah. When I got into dermatology, I was blessed to have a mentor, Dr. Wilma Bergfeld, who was a specialist in hair loss. And her passion, working in her clinic, the passion that I saw she had for patients, and the shame around this condition,
Yes.
just drew me in. This is something that affects a lot of women. Most people don't talk about it. They don't feel free to talk about it. And when they do tell their doctors, I'm losing my hair, it is usually downplayed or dismissed as a non-issue. So a lot of patients, express a lot of, gratitude when you acknowledge what they're going through with their hair.
Oh, that is so true. Even women friends don't talk about it. It's easy to say, do you have any thinning hair? Oh, no, not yet. I mean, people are in just such denial about it.
Absolutely. And if to admit that you have thinning hair perhaps is seen as, oh, you're getting older. Or you're kind of deteriorating.
Yes.
And so nobody wants that, right?
Now let's talk about the reasons. So what are the causes for men and women, and how do they differ, and all of that good stuff?
So hair loss is really not a diagnosis, right? You don't come to me and I say, you have hair loss, do this, this, and that. It is a symptom. A symptom means, it's something that you're experiencing, but there's an underlying cause. So when you come to me and you complain of hair loss, it is my job to determine what you actually mean. What is the root cause of what you're experiencing, the loss of your hair? So a lot of times it can be stress, right? When it's primarily stress-induced, your hair comes out in clumps. You put your hands through your hair and you lose a lot of hair. You wash your hair and it's coming out in clumps. When that happens, we call it telogen effluvium, which is a specific type of hair loss, very much linked to stress. Sometimes, an acute stress event, you lose a husband or a loved one, you lose your job, you're worried. Those acute types of events can lead to an acute hair loss, and that's what we call telogen effluvium. That's just one of the different types of hair loss.
And that's men and women?
That's men and women.
Okay.
Now, of course, when women lose their hair, it tends to be a little bit more traumatic, and they seek help more, right?
Right.
A lot of men go through it, and they don't necessarily think it's something they can get help for, and they don't come for that. But I have a lot of women that come traumatized is because it is traumatic. Put your hands through your hair and it's coming out.
That's
A
right.
lot of people think, what's happening? Do I have cancer? Is something going on? Right? So they come and literally I ask a lot of questions, fish it out, what's happening. In addition to stress, it can be something medical. So I do check labs to make sure there's no underlying medical problem that is causing that acute shed. So that is the condition of telogen effluvium, one of the more common ones.
Okay.
There is genetic thinning, all right? The one that is the most common type of hair loss, where your genes are dictating the hair loss. It usually manifests itself later on in life, late 40s, 50s, and especially during menopause. Now, this kind of loss is not acute. You don't put your hands through your hair and it's all coming out. It's a slow process where the hair gets finer and thinner, and then you start to see more scalp. You're like, what's going on in the top here? I'm seeing more scalp. It's a very slow process. Sometimes you don't pay attention to it till it becomes obvious, right? And women experience that. Men experience that as well. Now, this condition is often,
As they get older, men, so it's a man and woman thing, not just menopause.
No. It's a men and women thing. It's genetic.
Okay.
In women, it does tend to manifest itself a little bit more during that time
Okay.
for us, the menopausal period.
Okay.
Men can bald way before then. In addition, a few women can do the same because it's genetic. Your genes are dictating to your hair what needs, what happens. So your hair actually gets finer and thinner.
Now, can I ask a quick question? I've always heard that if your mother, I can't remember, it's either your mother, your father, your grandma, somebody, is it, if they went thin early, you will too. I know it's genetic, but is it directly linked to a parent or?
That's an excellent question. The truth is the genetics of this condition is still being researched. So I have patients who have thinning on their maternal side and they thin. They have thinning on the paternal side and they thin. It is not as clear cut in terms of which line dictates what you'll get. And to be fair about it, just because your parent has thinning it's not an 100% certainty that you will have it.
Okay, good.
If you have it in the family, it does put you at a higher risk, but it's not a certainty.
Okay.
Okay, that's important to know so that people don't go panicking, right? Yeah.
Yep.
Yeah.
Talk about, is there a direct link at all with hormones? Because it does seem like women, many women I know, once menopause happens and we're moving into our 50s and 60s, that's when
you start to notice
you start
some of this.
noticing.
Absolutely. We know that during menopause, estrogen takes a nosedive, right?
Right.
We lose, we produce less estrogen. And we know that estrogen is protective for so many things. When you lose estrogen, you get dryness of the skin in certain areas. We know that when you lose estrogen, your hair does tend to thin a little bit more. Testosterone is the opposite. That tends to worsen thinning. And so with that estrogen going down and testosterone unchecked, that is when, again, we can see a lot of thinning manifest itself. But it doesn't have to be menopause. I have 17, 18-year-old girls that are thinning because the genetics is so strong for this condition. They are the minority, though. The vast majority of women who thin, it tends to manifest itself late 40s, 50s during the menopausal period. But there is definitely a hormonal component. We believe that the genes communicate through the hormones to cause the thinning. And the culprit hormones tend to be what we call androgens, dihydrotestosterone.
I've heard of that.
Yeah.
And I've seen things, online that are shampoos and so on that are supposed to combat
shampoos and such. The premise for that again is those are the culprit hormones that manifest the thinning through your genes. Now, the question is, the DHT shampoos and products over the counter, are they going to prevent the thinning? Are they going to help you? And there's no clinical trial that tests those products. And I'm very cautious in recommending products for patients because I'm a physician. I want to see evidence for treatments. There's thousands of products online. I mean, a lot of money being spent, right? If you come to me, I'll give you recommendations that are based in some science, right? So it is true that DHT is shown to be a culprit hormone in this condition. Whether you get in their shampoo or shampoos and conditioners touting the benefits with DHT blockers and such, again, we need more clinical trials to show that they're effective. There are other ways to block these androgens through oral medications like spironolactone.
That's what we're going to get to.
Finasteride, yeah.
All right, I'm so glad you brought that up about the products online. I have to just say that some of them have, 1,000 reviews. And reading 1,000 reviews of, oh, this worked, oh, this didn't, is just not the same thing as a study that says this really honestly works. So go ahead and give it a try.
Absolutely.
It must be discouraging a little bit to you to have people come in with, oh, I tried
this and that, and they have a bag full of products that they've tried, and it's, to be honest, what else do they have, right?
Yeah.
When you have hair loss, it is an emotional condition. It's very distressing, especially for us women whose image is, we take hair as part of our image, as part of who we are, right? And so when that starts to go, you think, oh my God, what's happening to me? And you go out there and you try to find help for yourself. And there's no guide out there for you.
Nope.
You just trial and error and trial and error. And those reviews you're seeing online are people who've tried trial and error. The problem is, are they suffering from the same kind of hair loss you are, right? Are they having the same symptoms? You don't know that.
No, that's true.
You don't know that. That's what makes that different from a clinical trial where we're specifically looking at a condition. We control, the conditions under which we give you the medicine. We know whether it's working or not. That you can hang your hat on because it's specifically designed to determine whether something works or not.
Okay.
Reviews online.
I know.
Yeah.
I know. All right. I want to talk about, I've got a whole list here of now let's talk treatment. Starting with, I'm going to go from the easiest to the, so biotin. I take biotin with zinc. Are there studies that helps?
Yes. So very good. First of all, I want to clarify something. Vitamins don't necessarily treat a medical condition. You don't have diabetes and expect to take vitamins and cure and help your diabetes. You don't use vitamins to treat your high blood pressure, right? Vitamins are supplements. What that means is it gives some nutrition to your body. Biotin, we believe, is a supplement that improves the health of your hair. Taking biotin does not necessarily, if you have telogen effluvium, is that going to reverse your shedding? No. It just gives your hair, it's like bolstering, your body's own natural abilities to be less susceptible to damage and to wear and tear. That's what vitamins are for. When I'm giving a patient a vitamin for hair, I don't promise them that it's going to reverse their hair loss. It's just bolstering your hair's nutritional level so that it's less susceptible to wear and tear and weathering and stress, right?
Okay.
Because we do put a lot of stress on our hair. If you're already experiencing hair loss, you don't want to lose further with
dyeing
and highlighting and that's what vitamins are for. So again, when you come to me and I'm giving you treatment, biotin forte that has all the B vitamins. Biotin is just another B vitamin, by the way. I give that nutritional advice to all my hair loss patients. It's not a specific treatment for any type of hair loss. Okay? So the first thing I want to do before I treat you is diagnose you with a specific condition, right? Do you have the telogen effluvium, the shedding? Are you going through androgenetic alopecia? That's the thinning that you get. It's genetic, hormones play a role. Are you having inflammation in your scalp where you get the circles of hair loss called alopecia areata, right? It's an autoimmune disorder where people literally, your immune system attacks your hair follicles in little circles. There's a senator that recently, revealed that she had alopecia, the autoimmune alopecia where she lost her entire hair. It's very important for me to diagnose you with the cause of your hair loss, because remember I began this interview by saying that hair loss in of itself is not a diagnosis.
It's a symptom.
It's a symptom.
Right.
Okay.
All right. Let me go through another thing on the market
Absolutely.
that people talk about all the time for both men and women, and it's Rogaine or minoxidil. And I know it comes in two forms, liquid and foam.
And it's over the counter.
It's over the counter.
It's in a lot of, so the medicine itself is called minoxidil, right? Minoxidil is found in brand name products like Rogaine. There's a line of hair loss products called Keranique. Minoxidil is in that. It's in a lot of products over the counter. It's a growth stimulator, all right? It does have merit. Minoxidil can stimulate hair growth. We believe it kind of works through the hair follicle cycle. Believe it or not, we all lose hair each day. We lose about 100 hairs a day. Your hair is cycling through the growth phase, what we call the anagen phase, and then the shedding phase called the telogen phase. We believe Rogaine may play a role in reversing some of the hairs that you're losing and causing it to go towards the growth phase more. So Rogaine does work. It stimulates hair growth, and I do use it in many of my hair loss patients.
All right. So that they could do Rogaine, follow the directions on the box, and biotin to give themselves more nutrients.
Yes, those are very simple actions to take, but in my opinion, it is very important to get a diagnosis.
I agree. I completely agree.
You want to know what you're dealing with before you start throwing things at it.
Okay.
Okay.
Let's talk about Aldactone. I've forgotten the real name.
Spironolactone. That's
Okay.
excellent that you remember that. Spironolactone is an anti-androgen. It helps reduce some of the androgens, the DHT, the dihydrotestosterone, that we know to play a role in thinning. So I do put patients on this pill. It's a prescription. You can't get it over the counter. If I believe that your condition is hormonal and that blocking those hormones can help.
Okay. And is that it's also a blood pressure medicine, I think?
This medicine has multiple roles. Your primary care doctor may prescribe it for if you have fluid in your legs. It's what we call a diuretic.
Yes.
It helps you to get rid of some of that fluid. In dermatology, we use it for thinning hair, those who have excess facial hair, right? Believe it or not, this same medicine can block that and help with the excess facial hair. I do have to say a big caveat. The way we use it in dermatology is not FDA approved, okay?
Okay.
A lot of what we do in dermatology is not necessarily FDA approved, because we don't have too many tools that treat specifically hair loss. We base our treatments on what our observations and what the studies have shown, but they not necessarily be FDA approved.
Okay.
Okay.
Well, that shouldn't be too frightening.
At all. Lots of what we do is not necessarily FDA approved. I use a lot of spironolactone. I use a lot of minoxidil, among other things, to help my hair loss patients.
All right. Let's talk about hair plugs. All I can think of is Elton John. I remember when he had that, and then hair transfer, I think, is from your neck or something.
Hair transplantation.
So let's talk about those two.
Okay. So hair transplantation is an option that a lot of men and some women use, specifically very effective for the thinning hair, all right? There are doctors that specialize in that procedure, hair transplantation. With that said, I tend to want patients to have a medical evaluation and explore the medical treatments before you move directly to that procedure. So that procedure is just one of the many different treatments that you can offer patients specifically for different types of hair loss, again, like the thinning, androgenetic alopecia. That's the one type of hair loss that has been shown to be most effective in. So with that said, it's also a procedure that's not covered by insurance. It costs tens of thousands of dollars.
And I had no idea.
Yeah, and so again, when a patient comes to me, I will give them all their options. We start stepwise in terms of medical treatments. Once we have not, we haven't made any leeway, and I believe that transplantation will be helpful, then I will refer the patient to, there are several hair transplantation physicians in the area that I trust to do it.
Okay. I don't want to now not talk about plasma injections because I keep reading about that.
Absolutely.
So talk about that.
Because that is a treatment that has gained a lot of popularity in recent times. So platelet-rich plasma.
Oh.
So the treatment is often touted as the vampire treatment. I know the Kardashians used it. A lot of my patients say, "Oh, I saw it on the Kardashians," right?
Oh, goody.
Yeah, that's the authoritative source of information. So it's a procedure, platelet-rich plasma. When you come in, we draw your blood. That's why it's called the vampire treatment. We draw your blood, we spin it in a machine called a centrifuge. We take your own body's proteins that are used by your body to grow specific things, and we inject it into the scalp. And for a lot of people, especially those with the thinning hair, androgenetic alopecia seems to make a difference.
Women and men?
Women and men.
And you stick it right in the area of thinning, the needles?
Yes, it's an injection in the area of thinning. I know, it can be very traumatic for patients to hear, "You're going to stick a needle in my scalp?" It's something that we do, not just with the PRP procedure. I have a lot of patients, if you have the autoimmune alopecia, you come in and we inject that area with steroids because steroids help that condition. So injecting the scalp is not a novel procedure. We do it all the time in dermatology for very different conditions of the scalp.
Well, a lot of women get fillers all over and Botox. Does it hurt any worse than that? I know I'm asking you a dumb question, but
it's not a dumb question at all because the pain is often an impediment.
Right.
But most people are able to tolerate this just fine. We use a needle that is the smallest gauge, means a tiny needle, to do the procedure. Just like we do for the fillers and the Botox, we try to numb to the best of our ability. The vast majority of patients are able to tolerate it.
And Dr. Kyei, do you get it more than once? Do you come in every month or?
Very good question. There is no standard protocol that is used by everybody. Some of the data and the case reports and studies out there suggest that a monthly treatment, at least 3 times consecutively, seems to be very helpful.
And then that's it. I mean, then it could work.
Then it could work. You can, and I have seen it work in my own practice. Because we can't cure thinning hair, especially the genetics, right? I can't go and change your genes. Any treatment I give you needs to be an ongoing treatment. So I recommend that the PRP be done at least the 3 consecutive treatments yearly. All right. Now that's not unique to PRP. If the condition I'm treating cannot be cured, you have to be on treatment ongoing. If you have diabetes, I can't cure you. You take your diabetes medicine for life, right? It's the same principle, same concept.
We have enough time for you to talk about hope, I guess. Do you see things? I know that you're research is in this. Do you see hope on the horizon? With what you're doing now and what you see coming down in the future for, let's talk just women. I don't think men get as shook up about this when they're in their 60s as women do when they're in their 60s.
Yes, that's an excellent question. There is hope because traditionally hair has not been taken too seriously.
No.
So there aren't a lot of clinical trials that, there weren't a lot of studies being done specifically to look for treatment for different types of hair loss. That is changing. Recently, the autoimmune type of hair loss has gotten a lot of attention because there's a medicine that came out that helps other autoimmune disorders like rheumatoid arthritis was shown to be helpful for this specific type of hair loss.
No kidding.
And that opened a whole, different opportunity for patients with that autoimmune type of hair loss. The medicine is a medicine called a JAK inhibitor. It basically helps to minimize the immune cells that are causing the autoimmune hair loss. And there's been a lot of research into that, and I've had patients on this medicine who had complete total hair loss, meaning not a single hair on their scalp, eyebrows, eyelashes, everything gone. And this medicine has transformed their lives.
How wonderful.
Yeah, so there are some issues with the pill. These are the patients that I took care of had rheumatoid arthritis. That's the FDA approved indication for this medicine. So it was able to help with two conditions at the same time. It killed two birds with one stone.
Yeah.
And so I can see what this medicine can do. A lot of research is going on as to how we can get it topically so we minimize the potential side effects. In dermatology, we are very risk adverse. We do not want to cause harm, especially when we're dealing with healthy patients. So there's research being done right now that is looking to put this medicine, which is currently a pill, which that means it suppresses your entire immune system and you are at risk for other things. So we want it in a cream so that it can primarily work on the location we put it.
And not everything else.
And not everything else. So that's what
How exciting that is.
Yeah, so there's a lot coming up in the pipeline specifically for that condition, but I think it'll lead to more research in the whole field of treating hair loss.
I hope so. Gosh, I'm so glad you were here. I am. I'm speechless right now because I have more questions and I don't have time to ask them. But I think that if you are feeling as though a visit to Dr. Kyei would be in order, and stop looking at things online and stop trying your own remedies, I think it would be so worthwhile to give a call to her private practice particularly. And again, we will have that information on at the end of this show. Thank you so much for watching, and thank you so much for being here.
So happy to have been here. Yeah.